Good evening, ma'am.
Evening, my dear. Just a second. एक बार शेयर करके देख लेती हूँ। हाँ हाँ।
जी, ma'am.
बहुत सारे विंडो खुले हैं, बंद करो थोड़ा सा।
Yes, it's visible.
ठीक है, ओके। चल, मैं इसको स्टॉप शेयर करूँ। थोड़ी विंडो बंद करो, बहुत विंडो खुले मेरे लैपटॉप पे। हम्म, चलो अच्छा खुला रहने, कोई फर्क नहीं पड़ेगा।
This ring.
रिंग ना, आज देखो बस टाइम था तो मैंने डाली। थैंक यू। अच्छा मुझे
Matching with
ये
your
बोलो,
dress. Yes.
मैचिंग। मैं मेरे पास बहुत सारे रिंग्स है, तुम मिलोगी तो मैं तुमको भी गिफ्ट करूंगी, बहुत सारे, इतने सारे। हाँ। अच्छा मुझे ये बोलो कि जो रिलेवेंट क्वेश्चंस होंगे उसका ही आंसर दूंगी। आज मैंने एचआरटी को बहुत डिटेल में नहीं लिया है। मैं ना
Okay.
अगला सेशन एक और कर दूंगी, नेक्स्ट टू नेक्स्ट फ्राइडे। मैं डेट बोलती हूँ आपको, नम्रता, फिर आप
Okay.
ब्लॉक कर लेना
जी.
मुझे। मैं नेक्स्ट फ्राइडे नहीं, उसके नेक्स्ट फ्राइडे कौन सा डेट होगा? 12,
Okay.
12, हाँ, 12 सितंबर।
Yes.
आप घर से कर रहे हो या ऑफिस में हो अभी तक, नम्रता?
नहीं, मैं घर से आज मेरी छुट्टी थी, but then I'm like I work from home only then.
नहीं। अच्छा अच्छा अच्छा, हाँ। हम्म। गणपति की वजह से वैसे तो ओपीडी में ही बहुत लेट हो जाता है ना गणपति, और बारिश इतना पड़ रहा है कि पेशेंट मतलब जल्दी खत्म हो गया। तो आई रीच्ड होम अराउंड 7:30 ऑनली, 7:45 आई रीच्ड। नहीं तो
ट्रैफिक
भागते
कैसा है,
भागते।
मैम?
ट्रैफिक
ट्रैफिक
तो
कैसा है?
वर्स्ट वर्स्ट ट्रैफिक था, तभी तो बोले आज मैं जल्दी निकल ली, इतना बारिश हो रहा था। पेशेंट्स को जिसका अपॉइंटमेंट थे वो हो गए। मुझे मालूम था इतनी बारिश में कोई नया पेशेंट तो ऐसे आएगा नहीं अनलेस एंड अनटिल बहुत, है ना। ट्रैफिक तो यार गणपति की वजह से है ही ना, गणपति की वजह से ट्रैफिक होता ही है ना। हाँ हाँ।
आप आ रहे हैं लाल बाग के दर्शन करने?
नहीं नहीं, पूना के ही सारे दर्शन कर लूं वही बड़ी बात है यार।
हाँ,
तुम
मीनाक्षी
आओ,
गणपति.
एनी टाइम यू आर इन पुणे, वेलकम एट माई प्लेस। हाँ,
Yes, I'll be there in September. I'll sure visit you.
चलो, ओके ओके, मोस्ट वेलकम। लेकर ग्रुप में शेयर कर दूं।
जी.
हम्म। हम्म।
Ma'am, let's start. It's 8:30.
यस 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 माय डियर, श्योर।
Okay. Yes. We are live now. Good evening, everyone. I'm Namrita Madesh from Medisage E-Learning Private Limited, a leading platform dedicated for empowering medical professionals through innovations, expert insights, and digital innovation. In our today's esteemed Pearl series, it gives me immense pleasure to welcome Dr. Ritu Santwani, a name very well known to our Medisage community. Dr. Ritu Santwani, a highly respected obstetrician and gynecologist, infertility specialist, and sexologist. Dr. Santwani holds qualifications including MBBS, MD, PCOG, FIAOG, and Arts Singapore. She's the founder and CEO of 360-Degree Healthcare Studio, NUHS Singapore, and is recognized among the top 50 influential doctors on social media. Dr. Santwani also serves as the co-founder of MAAM and is a board member of SWWC, bringing a wealth of expertise in women's health. And we are truly privileged to have her with us today to share her insights on a very important and relevant topic, from dull skin to low libido, full menopause makeover. So without further delay, I'm delighted to hand over the session to Dr. Ritu Santwani. Over to you, ma'am.
Thank you, beautiful Namrata, and thank you, Medisage, for providing the platform. And friends, as all of you know, my this series is continue on the Medisage platform, and we are doing lot of webinars. So in last few days, I received some requests from some of the doctors. They are telling, "Ki ma'am, why not you are taking the some talk?" So we thought ki we will go into the topic which is very much relevant in these days. We have seen that lot of patients of the perimenopausal or menopausal age group are coming to us. They are having a lot of problems, starting from the up the hair fall or the hair thinning, or we are coming on the face, there is a melasma, they are having a weak bones, they are having a hot flushes, they are having a mental disturbances like forgetfulness, hot flushes, sweating. So today I thought, why should not we take a time for take out the time for this very important topic. So how do we go for a menopause makeover? Menopause is not the time, as we I always say that it is me no pause. So it's the time to make over in the time of the menopause, not to be get meltdown. So yes, I'm sharing my PPT. Yeah,
Yes, it's beautiful.
yeah. So friends, before I start, this is a very auspicious time going on the Ganpati Bappa days. So wishing you each and everyone a very happy Ganpati. So Ganpati Bappa हम सभी की जिंदगी से सारे कष्ट दूर करें और हम सभी के लिए प्रगति के रास्ते खोलें, ऐसी मैं प्रार्थना करती हूँ. हम्म. So my all presentations always start with my Mata Rani Stuti. Ya Devi Sarvabhuteshu Chikitsa Rupen Sansita Namastasei 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 Namo Namah. So I'll just take it. Yeah. So friend, the topic what we are going to discuss today, from dull skin to low libido, the full menopause makeover. So now in this, I'm going to deal how to focus on the points like beauty, confidence during menopause, along with the sexual health also. So yeah, I think I will close it down this window. Then it will be, yeah. So and it is a very vast topic. I try to cover as much as possible. So I have divided it into 4 or 5 categories. In the category 1, we are going to understanding menopause and impacts on body and mind. So as we know, friends, that menopause is a holistic transformation influencing not only the physical sensations but also the mental clarity, emotional well-being, and overall vitality. So recognizing this broader impact is the first step towards a comprehensive approach to managing our health. So the common symptoms which often extend to like sleep disturbances, mood fluctuations, cognitive changes like brain fog, and shifts in energy levels, all of which are crucial to acknowledge for effective management. So, friends, we have to understand the menopausal transition is primarily driven by significant changes in the hormone levels. We all are aware, particularly of estrogen and progesterone. And these hormones play a critical roles across the numerous bodily systems, including bone density, the cardiovascular health to skin elasticity and brain function. Understanding how these hormonal shifts lead to the diverse array of symptoms from unexpected weight gain to changes in libido provides a valuable insight, empowering you to make more informed decisions about your health and treatment options. So, in this, आज काम करूं? So, in this, we have to discover the evidence based solutions for comprehensive renewal. This includes the advancements in hormone therapies, lifestyle adjustments, and targeted wellness practices designed to mitigate the symptoms and enhancing the quality of life. The goal is to move from simply enduring menopause to actively thriving through it, reclaiming your energy, comfort, and confidence. So, in this talk, I am taking you into the deeper dive into a specific challenges and solutions which are discussed throughout the rest of the guide and ensuring to give you the complete picture that how to empower the menopausal lady. So, friends, here we can see the menopause is more than the hot flushes. Friends, as the topic is very vast, I will try to take as much as possible to the aid, each heading and details we can take for about each in the coming weeks. So, menopause fundamentally transforms the multiple aspects of a woman experience: skin texture, elasticity and moisture levels. As we know, the dryness of the skin is very common in the menopausal ladies. Sexual desire and comfort during intimacy, emotional stability and cognitive function, energy levels and metabolic efficiency, overall sense of vitality and confidence. The journey typically spans at the ages of 45 to 58, with the perimenopause and postmenopause lasting several years. So, friends, studies have shown that the Black and Asian women often experience symptoms earlier than the white women, highlighting the need for the culturally informed approaches. So, as we all know, that in this menopause, the hormonal roller coaster is there. As we know, the most important hormone, estrogen, the estrogen drops up to 90% during the menopause, primarily driver of skin elasticity, moisture, and vaginal health. Then, secondly, coming to the progesterone, steadily declines during the perimenopause, affects mood stability, sleep quality, and stress response. Testosterone also gradually decreases, which is critical for sexual desire, energy levels, and muscle tone. These hormonal fluctuations create a cascade of physical and emotional symptoms that can significantly impact the quality of life. But with the right approach, these all can be managed effectively. So, coming to the next, the related first, I'm starting with the skin crisis. What happens during the menopause? There's a very famous quote by the Dr. Elizabeth Tenji. The skin is a mirror reflecting our hormonal health. During menopause, that reflection changes dramatically as estrogen protective and regenerative effects diminish. So, there is a dramatic decline in the estrogen levels. A hallmark of this transition directly correlates with a rapid decrease in collagen and elastin production, the foundational proteins responsible for the skin firmness, elasticity, and youthful appearance. Due to this hormonal shifting, it accelerates the intrinsic skin aging, leading to a cascade of changes. Women commonly observed increased dryness, a noticeably reduction in the skin thickness, and more pronounced appearance of fine lines and wrinkles. The supportive structure of the skin weakens, often resulting into a loss of elasticity, increasing sagging, and particularly around the jawline and neck. So, as we all know, there is a loss of the collagen, the 30% collagen loss in 5 years. The dramatic drop in estrogen during menopause triggers the accelerated skin aging, rapid collagen depletion, structure and firmness decline, elastin deterioration, skin loses its ability to bounce back, decreased oil production causing the unprecedented dryness, compromised skin barrier, increasing the sensitivity and inflammation, slower cell turnover, dullness, and delayed healing. So actually, this I have kept the one case that one lady who is having that how the menopausal skin changes are there. Better I will take the next. Yeah. So the visual reality of the menopausal skin changes. Here we can see to compare with the premenopausal and menopausal skin. In premenopausal skin, the robust collagen network, while in menopausal skin, the thinning of the dermal layer, balanced moisture level, significant moisture loss, effective cell turnover, then here is the slower regeneration, resilient barrier function, increased fragility and sensitivity. Then, coming to the next is the low libido and intimacy challenges. So, menopause profoundly affects the intimacy and sexual health, yet, these changes are often the least discussed. Understanding the biological basis of for these shifts is the first step towards the reclaiming a satisfying intimate life. So, up to 75% of the menopausal women report the significant changes in sexual function, yet fewer than 25% discuss these concerns with the healthcare providers. So, friends, so usually the couple approaches us with this loss of libido. So, this libido decline is a silent struggle. So, the factors responsible for this are all hormonal, physical, emotional, and energy depletion. So, taking one by one, the hormonal factors, the testosterone and estrogen decreases directly, reduces the sexual desire and response. Physical changes, the vaginal dryness, thinning of tissues, reduced blood flow causes the discomfort. Energy depletion, as we all know, fatigue, sleep disruption, and metabolic changes reduces the energy for intimacy. Emotional impact, mood fluctuations, body image concerns, and relationship dynamic shift. Then coming to the non-hormonal approaches for intimacy and libido. So friends, we will take one by one. The vaginal moisturizers and lubricant, over the counter lot of things are available, but better we guide that it should be by the proper healthcare provider. As the healthcare provider, the gynecologist is giving the prescription. The pelvic floor therapy is very important that it strengthens the pelvic muscles, improving the sensation and reducing the pain during intercourse. Non-hormonal medications like osmipamine for the dyspareunia can address the specific symptoms without affecting the systemic hormone levels. Sexual counseling addresses the psychological factors, communication issues, and body image concerns that impact desire. Then, coming to the daily wellness and lifestyle, stress management is very important. High stress levels suppresses the libido. Practices like mindfulness, meditation, and yoga can help. Regular exercise boosts the blood flow, energy, and mood of which all of which positively impact the sexual desire. Balanced nutrition is very important, which supports the hormonal balance and energy levels. Supplements like maca, ginseng, all by the proper guidance of the doctor, treating doctor. Adequate sleep. Chronic sleep deprivation reduces the energy and that can disrupt the hormonal regulation. Communication with the partner is also very important. Open dialogue about the needs and desires can foster the intimacy and reduces the performance pressure. Now, intimacy without discomfort. What are the newer solutions? So, advanced treatments like CO2 RE intimal laser therapy, which stimulates the collagen production in vaginal tissues, restoring the elasticity and moisture. PRF, platelet-rich fibrin injections, harness the body regenerative capacity to enhance the sensitivity and tissue health. Radio frequency treatments, which improve the blood flow and tissue tone. Then coming to the daily supports, the hormonal supporting intimate products like stripes. Now these days the sprays are available, the O spray, adaptogens and phytoestrogen supplements that balance the hormones naturally, specialized lubricants formulated for the sensitive menopausal tissues. Hmm. Then coming to this menopausal makeover toolkit. So targeted skincare formulation addressing the unique needs of the hormone depleted skin, advanced procedures, the professional treatments to restore the skin structure and function, hormone therapies, options to replenish or mimic the crucial hormones safely, lifestyle optimization, nutrition, movement, and stress management tailored to the menopausal physiology. Then, what are the skin innovations? So, friends, here we can go one by one. First is the phytoestrogens like the soya supplements, red clover, mimic the estrogen skin supportive effects, applying daily in the form of the cream or serum. Peptides, which will reduce the fine lines and help in the production of the more collagen and elastin in the form of the serum. Retinoids, which accelerate the cell turnover and stimulates the collagen at night application. Um, Niacinamide strengthens the barrier function and reduces the inflammation. Ceramides, which restores the critical lipid, incorporating daily. Then Pakuchi oil, plant-based retinol derivative with estrogenic properties, having a good results. Then we have to explain them to avoid the harsh exfoliation, which can further compromise the already weakened skin barrier, focusing on the gentle hydration and barrier repair. Then what are the advanced aesthetic treatments are available? Neuromodulators, Botox, Dysport, relaxing the dynamic wrinkles while preserving the natural expression. Menopausal skin often requires more subtle application to avoid the overdone appearance. Fractional lasers create the controlled micro injuries to trigger collagen remodeling, especially effective for addressing the crepey texture and pigmentation changes common during the menopause. Then ELAC or microphoring, revolutionary approach that removes the thousands of the micropores of the skin, allowing the surrounding skin to close the gap, effectively reducing the excess skin without surgery. Radio frequency microneedling combines the collagen induction with hard energy with heat energy to tighten and firm the skin that has lost the elasticity due to the estrogen decline. Besides that, many more other procedures have also come. Then, coming to the hormone replacement therapy, friends, I am taking only the outline of the hormone replacement therapy. For details, we can take the another lecture. So, hormone replacement therapy, including the bioidentical hormones, alleviates the menopausal symptoms by replenishing the declining hormone levels. So, in this, the systemic options, the pellet therapy, subcutaneous pellets, transdermal patches, oral medications, localized treatment, vaginal estrogen like creams, vaginal cream, rings, suppositories, which will help to treat the genitourinary symptoms also, and topical hormonal creams. So, beyond the symptom reliefs, HRT offers the long term benefits like improved bone density and potential positive impacts on cardiovascular health. But this all should be done under the strict supervision. Then, coming to the other point is about the lifestyle and wellness for the lasting renewal. So, menopause requires a whole life approach. What you eat, how you move, and how you manage stress are as important as any treatment. A very innovative quote by Dr. Aviva Roman. Menopause requires a whole life approach. What you eat, how you move, and how you manage the stress. All the important points has been included. So, beyond medical interventions, a holistic lifestyle is a paramount for navigating the menopause with vitality. Intentional choices in nutrition, physical activity, and mental well being to optimize the health from within, supporting the hormonal balance and overall resilience. Among this, the nutrition and supplements, so fueling their body with nutrient dense foods like fruits, vegetables, lean proteins, and healthy fats. Supplements like omega 3, vitamin D, magnesium support for bone health, mood, and reduce inflammation. Exercise and mind body connection, regular physical activity, so, cardio strength training maintains the bone density, manages the weight, improves the mood, and enhances the sleep. Mind body practices like yoga, meditation, and deep breathing reduces the stress, anxiety, and hot flushes. Empowerment through knowledge and community. Understanding the menopausal journey and connecting with others is empowering. Education builds confidence, while the community support provides the shared wisdom and emotional connection. So, there are the lot of uh, New informed choices are available. Hmm. Then coming to the nutrition and supplements. So among this, the anti-inflammatory foods, we all know that it plays a very, very important role. The Mediterranean diet pattern, rich in olive oil, fatty fish, nuts, fruits, and vegetables, helps to counteract the increased inflammation common during the menopause. Phytoestrogen sources like soya, flax seeds, legumes that contain the plant compounds can help to balance the hormones naturally without the risk of the synthetic hormones. So we all know the vitamin D supplementation, either 2000 international units per day to 60,000 international units weekly. Omega fatty acids, magnesium glycinate, vitamin C all support the skin, bone, and overall health. Foods to minimize, yes, the alcohol, smoking, refined sugar, processed foods. So, as we all know, the alcohol again triggers the hot flushes and disrupts sleep. Refined sugars increase inflammation and glycation. Then, processed food worsen the hormone balances. Friends, I'm seeing a lot of menopausal ladies these days, yes, coming with these problems. So I asked about the history of this. So of course, there is these days all are very much diet conscious. So already the intake of sugar is zero. They are not having any processed foods, as they all want to maintain their figure. But they all give the history once we take the proper history. Yes, the history of intake of alcohol and smoking is there. Sometimes they say that they are going for some parties and that there. And once you take the detailed history, yeah, alcohol intake is more than 3 to 4 times in a week, and smoking also there. So these all triggers these problems. Then, what is the role of the Indian herbs and spices? So, in this, the various herbs which has been reported, the turmeric, ashwagandha, fenugreek, shatavari. So, friends, this slide is actually having because lot of things are here, so that's why it is overcrowded. So in this, the turmeric, because of the anti-inflammatory and antioxidant action, it helps to combat the systemic inflammation and oxidative stress. The dosage is 500 to 1000 mg of curcuminides daily. If it is given along with the combination of the black pepper, that will help to increase the absorption, so that will be good. Shatavari, which is known as the queen of herbs, rich in phytoestrogen. So it also helps in reducing the hot flushes and vaginal dryness. The recommended dose is 500 mg to 1 gram of the extract, 1 to 2 times daily. Ashwagandha, the adaptogenic herbs that manages the stress, improves sleeps, balance mood fluctuations, often experienced in menopause. The recommended dose is 300 to 600 mg of root extract. Fenugreek, methi, which mimics the estrogen, which can help with the menopausal symptoms, also support the healthy blood sugar levels. The dosage is 500 to 1000 mg, um, or 2 to 5 grams of methi seeds. I have specifically put the doses here because sometimes some patients approach to they tell, yes, we are already taking these kind of the supplements. So but once we go in the detail and we have to find out the what the supplements, because most of them are taking some or the other OTC products, in that all the ingredients have been mentioned, but they are in the very less uh, quantity. So turmeric 500 to 1000 mg, shatavari 500 mg to 1, and similarly the ashwagandha 300 to 600 mg. And once you tell about the fenugreek supplement, most of the patients will tell, yes, we are taking the constant already the fenugreek in our diet. So 500 to 1000 mg of extract daily, or 2 to 5 gram of the seeds. Then coming to the role of fruits and vegetables. So fruits, as we all know, rich in vitamins, minerals, antioxidants, and they help to combat the oxidative stress, inflammation, which can be elevated during the menopause. Their natural sugars provide the energy without the spike of the refined sugars. Then dosage has been recommended 2 to 3 servings per day. Prioritize the berries, huh? So blueberry, raspberry, strawberry, all the berries, citrus fruits. Then apples for their high fiber and antioxidant content. Hmm, has recommended. Vegetables, especially the green leafy vegetables, cruciferous vegetables, they all are good for all the things, and especially for the hormone detoxification and bone strengthening like calcium. Recommended dose of this is 3 to 5 servings per day with a variety of colorful vegetables like spinach, broccoli, bell pepper, and carrots. So the diet should be, or the plate should be the colorful. Hmm. Then coming to the exercise and mind body connection. So optimal exercise routine, the strength training 2 to 3 times weekly to maintain the muscle mass and metabolic health. Weight bearing exercise is necessary for bone density preservation. Then cardio, 150 minutes weekly at moderate intensity improves the insulin sensitivity. Flexibility work, yoga or stretching to maintain the joint mobility. Stress management, the cortisol elevation exacerbates menopausal symptoms. Regular meditation, breath work, and mindfulness practices can significantly reduces the symptom severity. So, just 10 weeks of this resistance training can increase the resting metabolic rate by 7% in menopausal women while improving their mood and sleep disturbances. So then, of course, the gathering in the social groups is also very important. As we know, most of the menopausal ladies otherwise undergo towards depression or loneliness, or the sleeplessness nights. So empowerment through knowledge and community, self-advocacy tools, symptom tracking, most of the apps has been reported, at home hormone testing kits, menopause specific health platforms, then finding the specialists, integrative gynecologists and menopause specialists, functional medicine doctors with hormone expertise, community resources, online support groups and forums, local menopause meetups and workshops, workplace menopause advocacy networks. This menopause conversation is changing rapidly. What was once whispered is now being openly discussed, researched, and addressed with innovative solutions. So, full menopause makeover starts now. Then, in this, menopause is not a decline, it is a powerful transition that can become a gateway to your most confident, vibrant self. Embrace the science of hormone optimization through medical and natural approaches. Invest in targeted solutions for your skin, body, and intimate health. Practice consistent self care through nutrition, movement, and stress management. Connect with the knowledgeable experts who understand the menopausal physiology. Aging isn't about the fading away, it is about becoming more authentically yourself with every passing year. You deserve to look and feel your absolute best at the every stage of the life. Your menopausal makeover journey begins with a single step. So, with this, I try to finish in the half an hour, was the time we have discussed. If there are any questions related to this, I will be happy to answer. So I have taken only the relevant, some salient points what we have to cover in this topic, because details I haven't taken, because otherwise it will take a very long time. So anyhow, some questions related to this, I will be happy to answer. Let me see.
Yes. Ma'am, I'll read it out.
Yes, yes, yeah,
Yes. Ma'am, the first question comes from Dr. Arjun Patel. He says,
yeah.
are your patients open to aesthetic interventions during menopause and in your practice? Or still, is there still hesitation due to lack of awareness?
Yeah. Yeah. Hi, Dr. Arjun. See, I am practicing in Pune and Koregaon Park area. The most educated crowd I am getting. So my most of the patients, they know the procedures compared to me. More than me, they are knowing the name of the procedures. So yes, most of the patients are very easily ready. If you have to convince them and you have to tell them what are the pros and cons. So you have to explain them, because half knowledge is always more dangerous. So only few patients are little hesitant due to the some side effects. They are little bit worried ki whether the effect of these procedures are only temporary, or they have to repeat the, and how much is the cost, only for that. Yes. So yes, most of the patients these days, once you convince properly, they are ready.
Ma'am, the next question is, should dermatologists play a bigger role in menopausal care?
Mm. Yeah, hi, Dr. Dhruv. So yes, see, dermatologist, because for the some things, if you want to send, otherwise you can go for a training for the for this cosmetology. I have done a course for this cosmetic, not only for the cosmetic gynecology, for the medical cosmetology also you can go, and these all things you can take care by yourself only. Why you want to send the patient to the dermatologist? These all things we can easily cover. The melasma, the hair fall, these all things you can easily cover. So better you can, I think, uh, because I'm covering all the things what is related to the woman. Because in my this, if you are having a very huge practice, obstetric practice, if you are not getting the time, in that case, of course, your uh, neighboring friend, the who is dermatologist, can deal with these.
Ma'am, the next question comes from Dr. Tejas. He says, do you
Yeah.
prescribe DHEA vaginal inserts or creams for menopausal women with GSM and low libido?
DHEA vaginal inserts, so I am not prescribing, yes, but DHEA the tablet definitely I am giving to the patients depending on their body weight. The usual dose is recommended is either the 25 mg 3 times a day, or these days a very good preparation 75 mg. A sustained release preparation is available. That too in the combination of the melatonin and in the combination of vitamin D. So we have to give only one tablet at night because that covers their sleepless nights issue. Also is also covered by the melatonin, and of course that will help in the for the low libido also. Instead of DHEA, I am using more the testosterone gel. I am getting the good results with that. Because with DHEA, the some side effects like increased hair growth and oily skin has been reported.
Yeah. Ma'am, the next question, the last question actually, from Dr. Kabir Shah. He says, are androgens underutilized in the treatment of menopausal sexual dysfunction?
Yeah, hi, Dr. Kabir. See, underutilized, I can't say, depending on the, because still we are seeing that some doctors, yes, especially the young doctors, they are to using all the things. They are using this androgen also. Yeah, depending, underutilized, you can say in some, in yes, the still there is a group of the doctors who are still going on the older science and older therapies. Yes, they are not very easily using this androgens, but most of the recently what are the recently the doctors who are attending lot of conferences, attending lot of webinars, and they, because in all that we are focusing about this androgen, so they are using.
Thank you, ma'am. These were the
Yes.
questions. Yeah.
Okay.
Yes.
Yeah. Yes.
Thank you,
So
Dr. Ritu Santwani, for such an insightful session. And we deeply appreciate the time and expertise you're sharing every time with Medisage community. And to our viewers, thank you for joining us. And those who missed the session will be available in the past event section. So be sure to check it out. And by the way, ma'am, it's the best slogan that I received in a long time. Menopause means me no pause.
thank
Thank
you,
you.
my dear. Thank you, Namrata, and thank you, Medisage, and thanks to all our dear friends who have joined. And thank you to Diksha too. So with this, we will wind up, I think, Namrata, and
Yes,
I will
ma'am.
be back again with another session on, we have just discussed the 12th
Of
September.
September.
Yeah, 12th September. The topic I will share with Namrata tomorrow or day after tomorrow. Then, and besides that, which topic do you want to listen? Our dear friends who have joined, so they can drop a mass on the message box. So we will try to cover these topics. Till then, bye
Okay.
bye, everyone. Bye.
Bye, everyone. Good night.
Bye. Good night.